Hello student, myself Rosamund Jurwa from the Department of Faculty of Pharmaceutical Science, Assam Downtown University. Today our video lecture will be on the local anesthesia. I will be going to explain a little bit introduction on anesthesia and definitions of local anesthesia, its classification, and a little bit mechanism of actions of the classification or the compounds of local anesthesia, and one compound in detail which is related with the local anesthesia. What do you mean by anesthesia? Anesthesia, as you already know, that it is a loss of sensation with or without loss of consciousness. It can be effectively achieved with a wide range of drugs with a very diverse chemical structures. Some of the list of such compound include not only the classes of anesthetic agent, but also you can see as the general and local anesthetic, but also many central nervous system such as your depressant, analgesic, sedative or hypnotic, that is your barbiturate and benzodiazepine, your anticonvulsant drug, and also your skeletal muscle relaxant drugs. Although various mechanisms of action are attributed to this agent, ultimately they all produce their anesthetic action by interfering with the conduction in sensory neuron and sometimes also motor neuron. Many of these agents are routinely used today in clinical practice to facilitate a surgical and medical procedure. What do you mean by local anesthesia? Local anesthetic agents are the drugs that, when given either topically or administered directly into a localized area, it will produce a state of local anesthesia by reversible blocking nerve conductance that will transmit the sensations of the pain from this localized area to the brain. Unlike the anesthesia produced by the general anesthetic, this anesthesia will produced by the local anesthetic is without loss of consciousness or impairment of a vital central cardiorespiratory function. Local anesthetic, it will block a nerve conductance by binding the selective site on the sodium ion channel in the excitable membranes, thereby reducing the sodium ion passage, that is conductance, through the pores, and thus they will interfere with the generations of action potential. Although as you can see that this local anesthetic decrease the excitability of a nerve membrane, they do not affect the neuron resting potential. This local anesthesia, in contrast to the analgesia compound, they do not interact with the pain receptor, or they will not inhibit the release or the biosynthesis of the pain mediators. Before in the 80s, it has been found that the clinical use of local anesthesia is normally from the cocaine. It means the first report of successful surgical use of cocaine appeared in 1884 by the Collars, an Australian ophthalmologist. The discovery led to the rapid development of new local anesthetic agent and anesthetic technique. Cocaine, it dependence or addiction is psychological dependence on the regular use of the cocaine. The use of cocaine, depending on the severity, can cause mood swing, paranoid, insomnia, psychosis, high blood pressure, tachycardia, panic attack that can lead to the aggressive, compulsive, criminal, and irritable disease. The symptoms of cocaine withdrawals range from moderate to a severe, which and the compulsive craving. Since cocaine have got so many side effects, so during the discovery or the synthesis of the cocaine, it was found that it became the prototype for the local anesthetic for nearby half a century, largely because it lacked the severe local and systemic toxicity of the cocaine. Although the intrinsic potency of cocaine was low and its duration of action relatively short compared with that of the cocaine, it was found that these deficiencies could be remedied when cocaine was combined with a vasoconstrictor such as epinephrine. Vasoconstrictors agent reduce the local blood supply and thereby prolong the residence time of the local anesthesia at the injection site. Following the introduction of procaine, hundreds of structure-related analogs were prepared and their local anesthetic properties examined in an attempt to identify the agent with enhanced potency and also the durations of the action, which will be compared to the weak and a short-acting procaine. Among this compound, you will be find that the tetracaine remain the most potent long-acting acid-type local anesthetic agent which is used in the spinal anesthesia. This is it for the introductions of the local anesthetic agent, and we will be seeing the classification in the next part of the video.